Governor, good afternoon. Governor Charlie Baker issued a statement today saying that Massachusetts is ready to assist Afghan refugees looking for safety and peace in America. Any comment on that and whether Rhode Island would join in offering its help to refugees?
First, I did have a conversation with the governor yesterday, not on that particular topic, but on other topics, so we're in contact with another. We have not really received any requests at all at this moment in time. We'll certainly, take strong consideration on any way that we have the facilities to help people, but at this point in time, I don't have enough information to make any further comment on that.
Governor, how are you? Why not just mandate masks in schools if you're already going to be working with these districts to try to get them to require it?
Well, you know that I was a mayor. You know that I believe in working with municipalities and not dictating to them. And in this case, we're gaining the success that we want. 80% of the districts have got there. We're going to work with the other districts. I believe there's a meeting tonight in one of the communities, or at least later this week. But I believe that on the local level, that local communities can participate in the discussion of what happens in their districts, and this has helped facilitate these discussions all around the state of Rhode Island. And I think that that's healthy, whatever side of the fence you're on. I happen to think that the municipalities and the school districts have come to the right spot. Otherwise, I wouldn't have had a joint press release with myself, with Dr. Alexander Scott from DOH, and with the Commissioner Fonte Green, making that recommendation in the latter part of July that we're asking the local districts to follow the CDC guidance relative to masks.
Ahead of Thursday, what can we expect for announcements? I mean, you're going to have the commissioner here. Are you going to be mandating it on Thursday, or?
So I think that we need to have patience, right? And we'll get there. And that's what I've been saying all along. And I do think that, people who are really questioning our approach to this are off base. We've been on target with moving the vaccinations. Remember, when I suggested that we would get all municipalities involved in the process of vaccination, we had the critics go out there and say I wasn't following science, right? Or when I actually decided that we were going to vaccinate teachers and related staff and child care and related child care staff, we had critics say that we weren't following science. But we were getting ready to make sure that our schools got open. So I would just say that this is not the time, to be injecting politics into this conversation. We have got it right, and right now we're 80% there. And Thursday we'll see where we are. Last week, all the districts were required to provide a reopening plan. We knew that that date was there. Since that was provided to us on Friday, we've been looking at those plans and determining through RIDE and DOH whether or not they actually comply and whether we make any recommendations. So we're going to continue to evaluate those plans up to Thursday, and then we'll have an update then, but we're 80% there. So the notion that you would mandate now into the 80% of the districts that have actually stepped up and followed CDC guidance, you don't need a strong hand there. We want them to be partners with us, just like we want the NEA, the AFT, the school committees, and the Superintendent's Association that have sent me a letter asking us to make sure that those districts that did not put that requirement in for masks when school starts, that we work with them to get them there. That is our intention to do that. And Thursday we'll have more of an update, and that's one of the reasons that we're going to have a COVID update, because it is an important area. And I don't want to diminish at all the effort that is being made to keep people safe. This Delta variant is a real issue. It is clearly one that we're talking about. We're going to have weekly press events, because it is a very important point in our fight and our battle against COVID. And just like we've stepped up on everything that we've done, we're going to step up on this one as well. The people of the state of Rhode Island should feel very comfortable that we can keep them safe, we can keep them out of hospital. God forbid, we do not want to go have another funeral on a COVID-related death in the state. And right now, Rhode Island is leading the country relative to its death rates per capita, its vaccination rates, it's in the top 5, right? In terms of its infection rates, there was only 2 states that had less per capita infection rate last week, as reported in the Providence Journal. So we're going to just stay the course. We're going to be patient. We're going to make sure our schools open up safely. And we're looking forward to getting to a point where we can really focus on the vaccinations of our students that are, that are eligible to be vaccinated. And we'll be working to do that. And just like we're working to get 90% of our adult population vaccinated, we'll be working to get 90% of our student population vaccinated.
Governor.
Dan and then Linda, then Pat.
Okay, thanks. Actually, question for each of you. For you, Governor, you said I think roughly 100,000 students go to school districts that are going to have a mask mandate already, right? Was that
Yeah,
the number?
that's where we are currently. I'm just giving you the current number,
Well-
and it's changing. Last night it was, I think, closer to, at the beginning of the day, yesterday it was closer to 50,000.
So my
This
question
is
on that,
happening very fast.
my question on that is obviously that leaves roughly 40,000 students who are not going to those schools. So what happens if like one school district decides not to do it? So that's my question for you, and then just for Lieutenant Governor.
We'll deal with individual school districts, and we will see how many people we can get there. And then, there's which was interesting that I would get a letter from, reps and senators on this issue when they actually put legislation in that the pandemic would be over on September 1st. So that's not the case. So what we need to do is we're working through the legal side of the issues in terms of how we can actually inject ourselves, not only on this issue, not only on the mask issue, but on the COVID-related issue. We did ask the General Assembly to extend the date from September 1st to January 1st when they got back into session. So, but based on the response that we're getting from the General Assembly right now, based on the other avenues that we have, we're still in the exploration days of how we can gear up to make sure that we can follow through on what the General Assembly is saying, that I have the authority to protect the state of Rhode Island in a way that makes sense during a situation like that we're in right now. And this issue, we're certainly getting to the point where we'll understand what exactly we can do, can't do into the districts that may be holding out. But my feeling is right now, and I just got texted another community that came on board that was hesitant to put masks into their community, and the list will come out because that'll become public. But yeah, I just got a text just before we came on today to talk about this. So my anticipation is that all our districts are going to be masking up, and then all our districts are going to be we're going to be working with them to get our students vaccinated, so that down the line, remember, this is not just a one-month issue for us. School is starting in September, is going to go all the way through the end of June. We need to make sure that we're doing everything we possibly can to make that a year that our students benefit from, and that's our intention.
And then just, Lieutenant Governor, you have 2 children in different school systems, so do you think there should be a state mandate for masks?
I'm happy to see that the district my son goes to, Providence, has asked for the mask to be used in the schools. I'm happy to see that. And I have noted, and I know that also Cranston have done it. I think the important thing for us to have to be aware of, we're talking about the safety of our kid in the schools, and the decision can be made at the school level. We have to be careful not to create a panic that goes to the business community in general. I think I agree that at this moment the school have the authority to make the decision, and they should do it. And yes, I agree with the mask in school.
And I also add in that Providence happens to be a school district that the governor has a great deal to do with right now. So it's no accident that we actually followed our office recommendation, DOH recommendation, and RIDE's recommendation to make sure the schools in Providence are masked up at the beginning of the school year. And again, we're going to make sure that we're working with every district in the state of Rhode Island, and the intention is that every district would be masked up for the beginning of the school year. And my anticipation is that that's going to happen.
The districts have already voted.
Next.
Okay, we'll come right back to you.
So Governor, a number of parents have told me that they are going to explicitly tell their children not to wear a mask. How are you going to enforce in any, particularly with young kids, if they show up without a mask and said, Mommy and Daddy told me it was okay?
So the school districts will be doing that, as a passed on a local basis. They're going to be doing their local enforcement, and we will be supporting them in that enforcement.
But just as a follow-up, will you be, this has been a huge problem in the South. Will you be asking kids to leave school? Like, do we know what the enforcement will look like?
I think that that's what we're working through on those plans right now, and then we are pressure testing all the plans with a core group of people that I've brought on in my office to make sure that all the school districts are going to be able to open safely. We're going to put the time in to make sure that the people understand that if they do something that is not in the regulations of the school district that they're attending, that this is what will happen. So I would hope that everybody would comply with the local masking. If they don't, I would hope that the local district would be able to give advanced information on how they're going to deal with that.
Governor, a two-parter. First off, do you find irony in the fact that municipal officials who are often scream bloody murder when they're handed mandates by a variety of state or federal agencies are all of a sudden seeking a mandate from the state government? And is that, in a sense, do you feel any of them are seeking political cover from what is obviously a difficult, contentious issue in many communities?
Yeah, so I think that, well, it clearly is on a state level, federal level, and local level. The mask issue is a political issue, more so than anything else. This is what I would say to the people who are concerned about masking, right? What's the worst that could happen? If you're right that somehow you don't need masks to keep kids safe, what's the worst could happen if they mask their kids? They're safe. But what's the worst could happen if CDC guidance is correct, that our Department of Health guidance is correct, that actually our kids at risk if they don't wear a mask? What's the worst could happen? Just think about that. As far as your question relative to local, I think that what's happened here is that the locals have stepped up. 80% of the districts have stepped up and have taken the heat. There was the Cranston meeting didn't go real smooth, but it was democracy in action. I believe that local discussion on these issues is important. I believe that discussion is going to get us closer to beating this COVID, and I think it's going to get us closer to getting people vaccinated. So yes, there's a sense of political cover in every seat that we sit in when we're elected. I just happen to don't think this is the time that politics should get involved in a situation when we're dealing with a pandemic that is putting our health at risk, our economy at risk, and our schools at risk. But Rhode Island, again, I'll talk to the people of the state of Rhode Island. We've responded very well. You've responded very well. We lead the country in economic recovery. We lead the country in vaccinations and safety issues right now per capita. And we're going to lead the country in terms of the way that our schools open up. We can do all three. We don't have to pick one over the other.
And Governor, there is an overwhelming sense of dread in many folks with regard to the upcoming legislative session. The fear is that, number one, reopening Pandora's box, anything can happen when the GA is open for business. And number two, we've got the specter now finally of the federal money hitting the Rhode Island government, if you will, scene. Number one, is there going to be an agenda published as far as what you and the General Assembly are going to do in this session? And number two, what will the executive branch do to promote transparency as to where these billions and billions of dollars are going?
Well, I don't know if it's billions and billions, but we got a billion. So, but at the same point in time, I am continually in conversations with leadership, as I've pledged to do, and they have collaborated, weekly meetings. I think we're coming off a chief of staff meeting as we're talking right now with leadership, with our chief of staffs, talking about how we could potentially get a jump start on some of the federal dollars so that we could keep our position of leading the country in our economic recovery and keep our position in keeping us safe. So in terms of, I don't know, I'm here every week. So as far as like an open book in terms of being able to ask me questions and being able to get information, I don't know much what I can do, but if I can do better, you tell me how I can do better, and I'll be happy to do better. But it will be an open dialogue in terms of how those monies are being spent. we're in the middle of, as the Lieutenant Governor said, we're in middle of, I think, the 12th to 15th public session that is online, that is outlining how we may be able to use those federal funds to jumpstart us towards towards a Rhode Island 2030. So we'll continue to do that. I would say to people who feel as though that they need more information, they should be calling our respective offices, and we should be providing them with the information that they're asking for.
All right, great. We got time for one more question.
Well,
Governor-
I'll stick around for a couple more.
Thank you. Governor, recently the Providence mayor issued a vaccination mandate for city workers by October 1st or produce a negative COVID test weekly. Are any similar discussions happening between your office and the state unions for state workers?
So the answer is yes. I mentioned that, I think, last week when I was at that question. There's no answer to that. Clearly, the areas that we have oversight over are masking up. You saw I walk in with a mask today. If you walk into the State House, they're masked up. So we'll take one step at a time on that and see where we end up. Right now, we are working on the measures that would require our healthcare workers that are working in state licenses to be vaccinated on or before October 1st. So we're actually putting the finishing touches of that. I was in a conversation with the Department of Health yesterday. So we'll take one step at a time. That's where we'll start. I do want to say, too, that the reason that we're doing the health care workers is because when we had the highest death rate in the country, and one of the reasons was I don't think that we were paying close enough attention to our nursing homes. So we know that, and as they're talking about the fact that booster shots are coming, right? That means that people in the nursing homes are going to be one of the first to get booster shots. And so we want to make sure when that bridge happens, and it's happening, I don't know how many months away we are, but it's clear that it's going to happen, is that we have all our healthcare workers vaccinated so that we don't have any level of potential critical illness in our nursing homes that can be avoided. So we're going to take the vaccinations very seriously. We are in discussions with our, as was publicly stated a few weeks back, that those conversations continue. Let's stay on topic, please. I don't want to be confused.
Thanks, Kathy.
At this point in time.
There are school districts that have already decided to make masks optional. So for Johnston, for example, what are you going to do to those school districts? How are you going to get them to change their mind?
We'll talk to them. I think that the data that is coming out right now, we know that the youngsters that can't get vaccinated, that their infection rates is going to be significantly higher than what it has been in the past. I think that we'll have those conversations. Remember, there's not one child in a school district today that's sitting in a classroom, right, that is actually in school. We're still 3 weeks away from the major openings of September 9th. We have a few districts that are going to open up before then, and we'll work with them as well. So there's time. We're going to have those conversations, and we'll have those conversations to see where we are on all those, not only the votes by the school committees, but also the plans that have been submitted. Those are being reviewed right now. It's a lot of work, but we're paying attention to it because we're going to have a safe opening for our schools.
Do you expect them to have a second school committee meeting to decide? I mean, I'm not sure.
There's still school committee meetings that are happening now on the issue. I believe that there's, last night you had Cranston, after the time frame when the plans came in. There's school committees meetings. I think there's another 4 or 5 school committees that I'm aware of that will be meeting on talking about this topic that are not included in our 80% numbers. They're not included in our 100,000 school student population.
Kathy's got our last question.
Well, there are actually 2.
She's got our last question.
All right, let's see what I can do with this.
Okay. I think everyone would be disappointed if I didn't ask you about the Eleanor Slater Hospital. And there was a horrific incident on August 10th, which several of us have written about, an eye gouging incident. And I understand that not only is the Joint Commission expected back, but perhaps CMS will be coming back in with them. And I guess the question there is, what do you know about the timing of the Joint Commission's return visit? And are you at all concerned that that incident and what it says about the culture of safety may not harm the state's chances of holding on to the accreditation of the hospital?
So on any issues that happen in any of the departments, including DCYF and the hospital, Eleanor Slater, I've asked to make sure that I get updated on the news immediately, which I was updated. It's under, certainly under an investigation right now. I'm not going to make comment while it's under investigation. Relative to the accreditation, my anticipation is that we're going to get, we're moving forward as in the last report that we had. I would hope that this wouldn't impact that. And I don't imagine that it would, but I'm sure that it'll come up in the discussions. And I would also would understand that it would be mentioned in the accreditation discussion when we come back and see whether we get an extension, whether we get accreditation. Those issues are still not known exactly what the next steps are, but I believe that we're in a spot where we're going to move forward. I just don't know how fast, but we will move forward.
A totally unrelated topic.
Oh my God.
But one of my colleagues, and perhaps some others, wrote about your chief of staff's wetland situation on a piece of property in Cumberland. And the question is, are you at all concerned about the appearance of political influence in DEM's decision to grant this wetlands permit? And have you actually investigated whether or not there was any undue influence?
So I'm not concerned about the influence. I am concerned, obviously with the headlines that keeps putting my name on the top of the fold when I had nothing to do with the transaction. So I am concerned about that. And I think that our chief of staff and his family came to the right spot. They're going to be donating that property to the town. And so that it will never get developed, and I believe that they came to the right conclusion based on, where they were at the moment when they made that decision.
What about the process itself? Have you looked into it to assure yourself that there was no political influence?
I haven't personally done that. I don't, I haven't done that. So I can do that. I know what I'm going to get as an answer. The answer is no, but at the same point in time, to satisfy the question, I'll look into it.
All right. Thank you all.
Thank you.